So my topic would be electroanalgesia and pain management. Let's get into it. So first, let's see the terms. The so what is electroanalgesia? It's a method of pain management that involves the introduction of a weak electric current at the site of the pain. Here we can see the more complex description if someone wants one, but basically we have different types of electroanalgesia. And the important thing is that electroanalgesia is FDA approved for over 15 years and has been into the practice for 25 years. And what is pain management? It is a branch of medicine that applies science to the reduction of pain. And there are different types of pain, which will be neuropathic pain, static pain, postoperative pain, and etc. Next. So, a little bit of history. Electroanalgesia is a relatively new treatment. So, however, there are some practices from past that seem to be very interesting. So, for the time of Aristotle, the patients who were experiencing pain, they were urged to stand in shallow water on top of electric fish, probably rays. I'm sorry. And it was not until 65 when Dr. Ronald Melzack and Dr. Patrick Wall suggested the gate control theory that a legitimate scientific basis for electroanalgesia was found. This theory and the endorphin release theory became the foundational rationale of electroanalgesia. Also important to note, the Chinese acupuncture methods are kind of the cornerstone of electroanalgesia. Well, we will touch them a little bit later. So the first type of electroanalgesia will be transcutaneous electrical nerve stimulation, shortly TENS, and it involves the transmission of the electricity from an external stimulator to the peripheral nervous system via cutaneously placed conductive gel pads. So basically this is our electricity conductor, and these are our gel pads, and they have to be placed on certain locations depending on the type of the pain we have to get rid of. And important to note, TNS is a traditional type of electroanalgesia, is the most often used type, and later on we will compare the other types of electroanalgesia to this one basically. So this is the second type. This is the transcutaneous acupoint electrical stimulation, TAES, and is a variant of the first one that involves applying cutaneous electrodes at classical Chinese acupoints and stimulating with alternating high and low frequency electrical current. So compared to the first one, here we place the pads on the Chinese acupoints and they just play around with the frequency until it has some type of the effect on the affected areas. And acupoint stimulation is an effective as dermatomal stimulation in producing an analgesic sparing effect after lower abdominal surgery. So here we can see the three types of locations, the acupoint groups, non-acupoint group, and the incisional dermatome group. This one, the lower abdominal surgery one. So next type, it will be H-wave therapy. HWT is a form of electrical stimulation that produces a direct localized effect on the conduction of underlying peripheral nerves. And this was originally recommended as an alternative to TNS for dental analgesia, but now it is being promoted for treatment of acute musculoskeletal injuries, post-operative pain, and non-invasive form of local analgesia. Also, why I inserted this photograph, it's because here we can see a little trademark, and so this is an ad for an electroanalgesic machine that helps to get rid of the pain at home and etc. Here we can see some high numbers and promising results and etc. But in a recently publicized randomized controlled trial involving a mechanical pain model, the analgesic effects of the H-wave therapy were found to be short-lasting and similar to the TNS therapy. Moreover, these investigators have previously reported that H-wave therapy fails to reduce the experimental ischemic pain. So basically, our goal as electroanalgesia is to get rid of pain. But this one, it doesn't even reduce the experimental ischemic pain. So even though the trademark and the ad, it's not really different from the original one. So the next type, it will be interferential current therapy, ICT, and it is another variant of TNS that uses the principle of amplitude modulation to decrease the discomfort of stimulating deeper tissues when using transcutaneously applied electrical current. So here what is different is the location of the pads. They place it like cross type so that the decusated area occurred high electric frequency here. So here will be the circle will be the affected area that we need to cure. And there are different combinations of stimulation frequencies here. And although ICT is used widely in the physiotherapy and rehabilitative medicine settings, there is a dearth of rigorously controlled studies to justify its effectiveness in the management of the either acute or chronic pain syndromes. And also some trials involving ICT failed to demonstrate an additional analgesic effect compared with traditional conservative management of shoulder and low back pain. So this also gives some proof that there are some situations in which it doesn't really differ from the original one, but still it applies a new type of methodology, and that improves the other types of pain release. The next one will be piezoelectric current therapy, PECT, and is an investigative analgesic technique based on the principle that mechanical deformation of a motorized piezoelectric ceramic rod produces a burst of 10 electrical pulses, each lasting 2-3 milliseconds, and half of them are positive and half of them are negative, because here we can see that we have 2 electrodes applied and one of them has to be positive and the other one has to be negative. So the application of PECT to the skin for 2 minutes produces a tolerable pricking pain sensation associated with a neurogenic inflammatory response lasting 3 or 4 hours. So basically we're inflaming the territory that we need to cure, because after it's gone, the pain will be gone with it, because the inflammation will be kind of make the pain less noticeable. So also it is important to note the basics that this method is working on. Piezoelectric effect is the ability of certain materials to generate an electric charge in response to applied mechanical stress. So this is the methodology that it's based on, and this is the tool that is usually used for piezoelectric current therapy. As a summary, we can say that there are different techniques that have been used for many years to produce electroanalgesia, and the techniques range from non-invasive, such as the first ones, the TNS and TAES, to minimally invasive and to highly invasive types. And recent modifications in the part of the electrical stimulus may further improve the analgesic efficacy of electroanalgesic techniques like TENS and PNT. And here we can see the comparison between the 3 main types of electroanalgesia, and some of them are inexpensive, some of them are in intermediate cost, and the other ones are very costly. Some are very invasive, some are not, and etc. So basically, there are different types. They're still being tested on. The methodology is very new. So, yes, and the results are barely the same because the goal is the same. So the only thing that varies will be the methodology. I hope this presentation was kind of resourceful, and thank you for your attention.